Here we are for another edition of On the Move with Dr. Beth. Kind of a cloudy, cool day out here, but I welcome that. This is kind of my jam, this particular weather, not the hot, humid stuff. But talking about particularly respiratory illnesses today, I know there's a lot of stuff going around. Obviously, the kids have been back in school for a couple of months-ish. Fall break time is coming up. A lot of things are being passed around. I've heard of strep throat, hand, foot, and mouth, all kinds of things going on. But there are things that you can do. I cannot express the importance of vitamin D levels for starters. The recommended daily allowance for vitamin D is 400 IUs a day. So I personally don't think that is enough at all. I try myself to shoot for 5,000 to 7,000 IUs a day. The 400 IUs is not based on optimal health. It's the minimum amount you need to not show a deficiency of vitamin D. So the best way to know where your vitamin D levels are is, of course, a blood test. A lot of times insurance won't cover that. But at any rate, I like to see vitamin D levels between 70 and 100 IUs. And it always needs to be paired with vitamin K, vitamin D with vitamin K, so that the calcium from the vitamin D gets into the bones and the teeth where we want it versus the vessels and the arteries where we don't want calcium, right? So also talking about immune function, vitamin C. So we get vitamin C from fruits and vegetables, not so much when they're cooked because that level tends to go down a little bit, but humans cannot manufacture their own vitamin C, so we have to take it. Vitamin A also, I know I've talked about that before. It really helps the integrity of the cell membrane, so viruses can't get inside. Colostrum is also good for immune function, gut health. I really call it kind of nature's antibodies. I've mentioned before NAC, N-acetylcysteine, an amino acid, helps build glutathione levels in the body, which is your master antioxidant. Melatonin, and also I want to add in here nasal washes can be very beneficial if you're experiencing some sinus issues. There is a saltwater neti pot. There's also a formula, it's called Clear, but it's spelled Xlear. It's a type of sugar, xylitol. Xylitol is not good for dogs at all, so make sure if you check that out, keep it away from your dog. But at any rate, just wanted to kind of cover the bases there as far as some different options for you. You don't have to do all of them, but want you to know specifics about each one and what you can do.